They say behind every great man is a great woman. It's certainly true in the case of Dr. Thomas P. McHugh. While Dr. McHugh is busy being the multi-degreed, board-certified plastic surgeon, it is his wife, Catherine, who manages the otherwise all-female office catering to the greater Houston area. The two have successfully been able to maintain a stable home life while at the same time manage the busy practice.
I always wondered how people could, or why they would have their wife in the office and doing things in the office. But then after a while, you kind of figure that the only other person that has the same high of an interest in success of that practice is that other person.
Hi, James. How are you?
He takes care more of less the medical side, where I take care more of the financial side. And patients know when they call in that they can basically count on me to be there to help them with anything that they have.
Right now, Dr. McHugh and the team take on a breast augmentation with a patient who's going from saline to silicone. Find out why. Dr. McHugh has successfully performed more than 2,500 breast augmentations. In the case of this patient, she wanted to switch out her old saline implants for new silicone implants, which have a softer feel and a better shape for her body.
Silicone implants are by far a better cosmetic product. They just feel more like normal breast tissue. If there wasn't a difference, then we wouldn't have gone through 15 years of studies that I participated in to put silicone implants back on the market to give people an option. We don't tell people to, hey, do this implant, do that implant. You just show them these are the options. Each implant has the same warranty. They basically will look very similar, just the feel of the breast is different with silicone. So it's all those options.
This young lady has saline implants, and they were placed many years ago, and now they've got a slight contracture, which just doesn't like the feel of the saline implants, and that's what we see with a lot of patients. The feel of the saline and the silicone implants are distinctly different. So most people choose in this day and age silicone implants. So she already has some. We're going to put new implants in, slightly different shape as a new shape of implants. We're going to do that, take about an hour's time, and she's going to be real happy with the new results and the new feel of her breasts.
A breast augmentation involves using implants to fill a desire for fuller breasts or to restore volume after weight reduction or pregnancy.
The surgery I do is not done in the office. It's done under a general anesthetic with all board-certified anesthesiologists with everyone's safety at the utmost concern. It takes generally about an hour to do. People come in, have it done, go home. There's no drainage tubes. Special bra they're put in, back to normal activities in about 10 days, back to their workout schedule in about 3 to 3.5 weeks.
Later in the show, back at their lovely home in the Woodlands, Dr. McHugh discusses what you need to know about choosing a plastic surgeon.
Silicone implants are by far a better cosmetic product. They just feel more like normal breast tissue.
Earlier in the show, we took a glimpse into Dr. McHugh's office and saw saline implants replaced by silicone implants. Now, back at his home in the Woodlands, here's what you should know about choosing a plastic surgeon.
When considering plastic surgery and which plastic surgeon is right for them, certainly other patients' recommendations are important, but checking out board certification, checking out hospital privileges, checking out their state board if they have any judgments against them, are all very important, and also checking with your family physician as far as if they have any recommendation as far as a plastic surgeon in the area. I think all those are very good ways to check, and I know a lot of times people seem to know more about me than I do when they come in because of what's available on the internet.
Board certification is an area of critical importance to every doctor featured on Modern Beauty. Dr. McHugh explains why.
Anyone can do any type of medical practice once they have a license. But to be board certified in especially means that you've done proper training and gone through fairly rigorous exams to verify that training. Board certification is basically the basis that people go by of trusting the physician, and that they have at least a certain base knowledge. Doesn't mean that person is going to be the best plastic surgeon. No, it means that they have this basis of knowledge, and it's not like the power of God comes through your hands once you pass the boards. but it does mean that you've done what you're supposed to do.
To review, here's a list of what to check on before choosing a surgeon. Educational background, board certification in the applicable specialty, hospital privileges with an accredited hospital, judgments against physician, patient references, family physician recommendations. Additionally, Dr. McHugh recommends websites like plasticsurgery.org for more information on physicians and procedures.